Understanding Alzheimer's antibody treatments, Lecanemab Donanemab. Simple guide for families. 1. What these medicines aim to do. These medicines remove amyloid from the brain. They do not stop Alzheimer's, do not improve memory, and do not restore lost abilities. Their only goal is to slightly slow the disease's progression. 2. What is amyloid and why is it important? Amyloid is a protein that becomes abnormal and forms clumps in the brain called amyloid plaques. These are commonly seen in Alzheimer's disease. Removing amyloid may mildly slow memory and thinking decline, but does not reverse the disease or repair brain cells. Amyloid is just one part of Alzheimer's. Other factors like tau tangles, inflammation, vascular issues, and aging also play key roles. 3. Why conflicts of interest matter. Many doctors involved in clinical trials or drug development might receive payments, consulting fees, or research funding from pharmaceutical companies. This is common and not necessarily wrong, but it can cause natural human bias. A doctor paid by a drug company might, without realizing it, be more optimistic about the drug's benefits. Families should seek guidance from clinicians who can interpret data independently without financial ties to the makers of these medications. 4. What is the CDR-SB score? CDR-SB stands for Clinical Dementia Rating, Sum of Boxes. It evaluates 6 areas of daily life: memory, problem solving, community involvement, home hobbies, judgment, and personal care. Each area scores from 0, normal, to 3, severely impaired. Total scores range from 0 to 18, with higher scores indicating more impairment. Example, moving from 0.5 to 1 in any area means going from a little trouble to needs some help. This is the most common scale used in dementia clinical trials, so you need to understand it. 5. What does 27% to 30% slowing really mean with the use of these drugs? TV commercials and drug ads may say things like slows decline by 27% or 29%. This sounds impressive but isn't exactly what it means. Alzheimer's worsens each year. Without treatment, a person might increase by about 1.5 to 1.8 CDR points over 18 months. With treatment, they increase by about 1.1, 1.3 points. So the actual difference is only about 0.3 to 0.7 points on an 18-point scale with these drugs. Drug companies and many doctors convert this small difference into a big percentage. A 0.5-point difference becomes 27% slowing, and a 0.67-point difference becomes 29% slowing. What should families understand? The person still declines. The difference is small and often not noticeable day to day. 30% slowing does not mean 30% improvement. 6. How much do these drugs help? They slow decline modestly. The person still gets worse. The benefit is small and usually not noticeable in daily life. What is the main risk? ARIA, brain swelling or bleeding. Lecanemab, about 21%. Donanemab, about 36%. Some rare cases are serious or fatal. Frequent MRIs are necessary. What is the average cost in the USA? Medication costs. Lecanemab, approximately $26,500 annually. Donanemab, approximately $32,000 annually. Additional costs, multiple MRI scans per year, infusion center fees, lab tests. Estimated total yearly costs, $30,000, $60,000, depending on insurance and co-pays. What is the treatment process? IV infusions every 2 weeks, Lecanemab, or monthly, Donanemab. Regular MRIs. Continuous monitoring, who qualifies, very early Alzheimer's, MCI, or mild dementia. Positive amyloid test. This is not for dementia with Lewy bodies, Parkinson's disease dementia, PSP, or vascular dementia. Good overall health. You need to have realistic expectations. These drugs will not improve memory, stop disease progression, or restore lost abilities. These drugs may slightly slow decline or delay loss of abilities by a few months. Simple analogy, Alzheimer's is like going down an escalator. These drugs do not stop the escalator. They only make it go down a little slower. You still descend. Bottom line, benefits are small, risks and costs are significant. It's reasonable to choose to accept or decline treatment based on the patient's and family's goals. Independent interpretation of data, free from financial influences, is often the most reliable way to make medical decisions. If you like this video, do not forget to share, like, and subscribe to my channel.